Welcome to the Birth Lounge. Now let's talk all things birth with your host, Andrew Davey. This podcast is brought to you by iBirth Professionals.
Hey everyone, welcome episode 10 of the Birth Lounge, and we've got a VIP super guest today. I'm really stoked, absolutely amazed that she said yes and found time to come and have a conversation today. As the co-founder of Lamaze Australia, now Lamaze being a brand that everybody knows, it's something that we hear about, even in the movies, I've heard that name.
Yep.
So it's very cool that we get Tanya Cawthorne Strusberg to come and have a conversation with us about all things birth and about what brought her into the birthing world as well. Tanya, thank you so much for giving your precious time to come and have a conversation today.
Oh, thank you, Andrew. It's a pleasure. Thank you for inviting me.
Oh, awesome. So glad you said yes. There's so much I want to ask, but let's see where the conversation takes us. But I guess what I always love to start with is to learn a little bit about what brought you into that world. I'm sure you didn't wake up one day and say, I'm going to be the founder of Lamaze. You made that decision happen. I'm sure it evolved just like birth does.
Very much so. And I actually was having this conversation with a friend the other day when I realized this is actually my third career. And, I'm not that old, but I've had three very distinct kind of, career paths to date. And I think I finally, without doubt, have found my real calling, if you like, in life. I think like a lot of people who find themselves in this work as an educator, as a doula, as a birth worker in general, is often because of their own journey to becoming a parent. And that was very much my experience. I didn't come from a sort of a science or a health background or a medical background in any way, shape or form. For many, many years, I worked in the performing arts, so completely different industry altogether. Although some would argue that I do get up and perform in my classes, so maybe I'm using some of those skills in my job now. But so obviously you can tell from my accent, I'm Australian, although I did grow up in Asia, in Hong Kong, where I was born. I lived there for till I was in my early 20s. My parents were Australian, so that did bring me back here to Melbourne, where I live, for a number of years. But I think like a lot of people who grew up, overseas were kind of born with a bit of a wandering, kind of instinct to sort of explore the world and that itchy feet syndrome. And so I kind of decided to up and explore the world a bit. And I moved to Israel when I was 30, of all places, and ended up there for quite a long time, sort of about 8 years altogether. And that's where I had my kids. And when I was pregnant with my son, who's now 11, I attended a Lamaze class, really. And it wasn't that I was specifically looking for Lamaze, although obviously years later, I have recognized what an amazing education it is for pregnant women. But at the time I had one goal, and that was to find a childbirth class in English. I was like, I need to understand what I'm going through here. And so I attended this fantastic class and learnt so much and felt so much more prepared for my labour and birth, both from an informational point of view. I think emotionally as well, it really helped me to prepare myself on a sort of a deeper level. Often I think people assume that if you are a birth worker, you have these amazing, ecstatic, perfect, natural births, and nothing could be further than the truth. With my son, I had every intervention under the sun, bar a cesarean section. But saying that, I credit 1,000,000,000% my education and my preparation for that labor, in that is what prevented me from having a really difficult experience where I otherwise probably would have experienced, crazy levels of anxiety and stress, and possibly even really severe postnatal depression. I think that's quite a reasonable possibility had I not been able to understand what was happening and why things were happening, in real time. So fast forward. So yes, my son, I had my son, and then a year and a week later, I had my daughter. So I have two, insane. I have two children. My daughter's only a year younger than my son, so she's 10. Same hospital, adjacent birth suites. It was all a bit deja vu. Didn't need to do a childbirth class again because it was very fresh in my mind. But I think what happened was that it really was a bit of a full circle journey. The woman whose class I had attended is an amazing woman. I shout her name out any opportunity I get. Her name's Rochelle Oserin. She's a phenomenal educator. She really is my mentor. She's the reason I got into birth work in the first place. She started the first Lamaze Childbirth Educator training program in Israel. And I was part of her pilot group. The first year she ran that program, which was in 2011. And we were an amazing group, small group, but just as diverse as you could imagine, you know, young and old, religious, secular, Jewish, Muslim, everything in between. It was just an incredible group to learn with. So that was really, I think, my entree. That was doing that course, initially being in a room as a pregnant woman, learning from Rochelle, you know, as a mum, and then coming back into that same room where I'd been pregnant and learning as a childbirth educator just a couple of years later. So it was a little bit trippy. It was kind of like, you know, having to do a bit of a mind bend just to go, no, I'm not sitting here as a pregnant woman. I'm sitting here as a student, as a student educator. So, and it was just, the education, the training was amazing. I think, you know, whether you know, just even having your own kids, just opens your whole world up to things that you just don't even think about, you know, and the training just really built on that. It really built on what was clearly just a passion I didn't actually know existed until I started to explore it.
That's amazing.
Yeah, so that's kind of how I got started, was doing that training in Israel nearly 10 years ago.
That's incredible. So that time frame then, so when you left Israel to Australia, how long were you in Israel after you did the training and things? And then,
well, not long actually. We came back to Melbourne in 2012, so I was really newly certified, and was super enthusiastic. I thought, you know, I would get started in Melbourne and, you know, launch my business and start teaching classes. And the first thing I did was actually try and kind of hunt down, locate other Lamaze educators here, because, you know, as you mentioned at the beginning of the interview, Lamaze is a household name. It's very well known. It's been around, this is its 60th anniversary year. So it's really established. You know, our grandmas did Lamaze back in the 60s and, you know. So I just fully expected there to be other Lamaze educators dotted around Australia. So we have an international directory through the Lamaze International website. So I typed in Australia and lo and behold, my name popped up. Only my name popped up. So I realized very quickly that I was it. So I kind of had a double, I suppose, you know, barrier to overcome, in that, one, I was just starting out. No one knew me. You know, I had no track record as an educator. But I was also trying to overcome the barrier that people just didn't know what Lamaze was. They've never heard the name, or if they had, again, you know, you mentioned the movies and stuff. I think people go, oh, isn't that from America, or isn't that like from TV, without really understanding what Lamaze education is actually all about. So it's, you know, 2012 to now, you know, 8 years later, a lot's changed, and it is very exciting to see how Lamaze has grown and developed in Australia. We've got a long way to go, but I think what we've done to date has been really exciting. So there's more than just me now, which is really good. There's over 50 of us now across Australia. So, and that's because I've been training educators for the last sort of 5 years or so in different states across Australia. So.
Absolutely amazing. You know what I love too, because I meet so many birth professionals that are there doing it themselves. You know, they've become an educator of whatever that is. So I think there's some inspiration for them in noticing you. You know, I think that maybe I'd love to get into that in a moment, but I'd love to understand, Tanya, you know, maybe your take on birth. You know, if we look at all that you understand and do for women with Lamaze, what is that? I mean, there's a mission Lamaze has, but I'm sure that there's a personal mission for you.
Yeah.
What is that? What is it for you?
I think one of the things I'm really most passionate about is equity in maternity care. And I think regardless of whether or not we live in, a country like Australia, where we are, for the most part, very fortunate, to be in a highly developed country with a very good quality of medical care. There is a saying which is gathering traction around the world in the maternity care industry, which is too little too late, or too much too soon. And basically what that means is that for women who are living in developing nations, they're often, unfortunately, the recipients of the too little too late, maternity care system, where there just isn't the advancement in medical treatment, in access to care, access to antibiotics, access to emergency surgeries, for example. So there are women who are needlessly dying in the perinatal period because of purely of a lack of access, which, is an equity issue as well. In Australia and places, like Singapore, like, the UK, the US is a unfortunate example, but a very good example of the too much, too soon, where we have over-medicalized birth. We jump in and we try and fix things when there's nothing to fix, because we assume there's going to be problems later on. So a lot of very otherwise healthy women who are having healthy, normal babies find themselves on, almost like a conveyor belt of intervention, where a normal, healthy physiological process is suddenly turned into a pathological process. And so the amount of harm that we are doing to women and babies is really unconscionable. And the outcomes of that are poorer health outcomes. Women who have short, medium and long-term injuries and health issues that relate to their intervention during labor. We know that babies are affected as well, again, in that short, medium and long term. And then we're not even touching on things like birth trauma, which we know is a huge issue. In America, it's even a bigger problem, particularly with the health equity lens, because we know that that women of color, for example, are at significantly higher risk of maternal mortality compared to white women. And we see that in the UK. We also see it in Australia to a lesser degree, thankfully, but still there is, quite significant disparities between Indigenous women and white Australian women, and also refugee and asylum seeker women, for example. So I think, that's a huge passion for me, is to right the wrongs there, to, in developed countries like where I live, is to really pull back from this over-medicalization of birth. By all means, we want to care for and treat women and babies who truly are genuinely at risk and who need that added level of intervention. But let's leave the healthy mums and babies alone and let them, go through that normal process and reduce risk for them. And then on top of that, to really relook at how our system functions and admit that we are not serving all families equally in this country. And that's something I really hope at some point I'm able to make an impact and help to change that picture, that reality.
Well, I'll be first to remind you, I know you are. I've seen the amazing work that you're doing. I did a whole lot of research before this call. So, I think that to be very proud of what you've done. And, obviously climbing a mountain starts with a step. Now, when it comes to the mountain, and we look at the mountain itself, this is everything you said truly resonates with, I can imagine, so many people listening into this. Where do you believe that it stems from? Like, where is the real problem? Because people are just doing their best, right? In all situations, so absolutely. When we look at it, where do you feel, if you're going to put your energy into righting the wrongs, as you said, or making this right? And I'm talking about, obviously, from, we look at minorities, if we give them that label in a way, and the challenges they face, and also from, just letting people birth, allowing it to happen. Where does it, well, I'm really curious.
I think there are systemic changes that need to happen right from the very top of our system, and how maternity care functions and operates. So there's some very, very big structural changes that need to happen. I think one of the first things that we can do, and this is absolutely borne out by decades now of research, and that is we need to truly move to a continuity of care midwifery model for women of all levels of risk. Again, we know this from top obstetric and midwifery journals. The Lancet published an entire series devoted to midwifery care a few years ago. We know that it's the gold standard. Obstetrics is a speciality. Obstetrics is amazing and fantastic and life-saving, again, as I said, for the women and babies who need that extra intervention. But having obstetricians care for healthy, low-risk women is kind of crazy, and really unnecessary and over the top. And what I think is really interesting is that, again, research has shown us that even high-risk women still have better health outcomes when they are primarily cared for by midwives. So that's one of the things that I would like to see really change here and other places. People will argue, but Australia does have a midwifery model of care, which is true to a degree. If you birth in a public hospital in Australia, which 70% of Australian women do, you will be cared for primarily by midwives. The problem is that they are not operating autonomously necessarily. They are operating according to obstetric guidelines and policies and procedures that have been imposed on them, and how they care and how they manage, their patient load and how they care for women. So it is midwifery, but it's midwifery, but ... And again, if you look in the private, maternity care system in our private hospitals, you see huge differences in the way women are cared for. And as a doula, I mean, that's another hat I wear. I get those insights because I travel in and out of those different birth settings, from home birth, hospital birth, both in the public and the private system, private independent midwives, that whole spectrum of care options that are available. And you see massive differences in the way women's pregnancies, labor and birth are managed depending on the care provider.
I've had many conversations with midwives, and I hear and sense and feel the frustrations. And
yeah, it's a bit broken record, isn't it?
Wow. And
It's
it's so sad in hearing the stories and knowing that, they got in for the reasons that they got in for, and maybe there's been a disparity of what they thought and what they now see are two different things. When it comes to midwives and midwifery, so New Zealand's a great example, correct?
New Zealand's a great example of how to do it well.
Right. Now, if you give us a comparison, then you say maybe finish my sentence, Tanya. I'm really curious because I love that we're digging into this. Thank you. When we look at midwifery care in New Zealand and we look at midwifery care in Australia as an example, let's use that example. It's fresh for you. What is the main difference? Help us understand, and what is the difference in the outcomes that you?
Sure. Well, I mean, I'm not a super expert on the New Zealand system, but from what I do understand, essentially all women are cared for by a midwife, and a midwife of their choice, which is amazing, and that it is fully subsidized and by the government, so women are not out of pocket for their care. They're not also in Australia in the public hospital system, but just to give an example, here in Melbourne, we only have 2 publicly funded home birth programs. These are programs which are, highly restrictive in who can access them. You can very easily be on that program and then be bumped off that program if you fall outside, the very, very strict guidelines, that you need to qualify for that. So New Zealand has a program where you choose your midwife that immediately is empowering to the woman, that she chooses her care provider. that home birth is, is just as much an option as hospital birth. Of course, look, saying that, I mean, most New Zealand women will still birth in a hospital. But I think that there isn't the same level of, what, you had your baby at home, or you're thinking about having a home birth? Are you insane? I don't think people there would have that same reaction. In the same way the UK to a degree as well. I mean, the NHS supports home birth as a very legitimate option as well. But I think that the fact that the government in New Zealand many, many years ago, I think it was Helen Clark, who was, previous Prime Minister, who really put money and, and really overhauled that maternity care system to really put power with women and the choice with women. Whereas what I feel what we're doing in Australia, unfortunately, is a little bit backwards, and that we tend to look more to somewhere like the US for guidance, which is not the direction we want to be going in, and moving towards a more obstetric model. We are really eroding women's choices in most parts of the country, in that we are removing home certainly home birth is a very, very, very limited option for most women. Birth centres or family birthing centres have, in Melbourne, have disappeared altogether. Several hospitals until just a few years ago had like a birthing centre within them, which is like a home-like environment for, low risk environment for birthing, and they've all gone. So women really now just have very the option of either just a very standard obstetric unit, maternity unit. A few hospitals have a sort of a know your midwife continuity of care model, which is amazing, but only about 10% of women in each of those hospitals can access it, because it's a one-to-one program. So it's impossible at the moment with the staffing structures to be able to make that available to all women, birthing in whatever particular hospital. So there are those differences, and I'm really concerned that I think most women, the average woman on the street who's pregnant or thinking about having a baby, has no idea how limited her options are. And the normal process of what happens when you're pregnant, or you think you're pregnant, you go to your GP, you get the pregnancy confirmed, and you pretty much get asked one question, and that is, do you have private health insurance? If the woman says yes, the doctor will say, would you like me to write you a referral to a private obstetrician? If the answer is no, then the doctor will say, well, based on your address, you're zoned to hospital X, you need to contact them, they'll arrange your first appointment, which is often, at the moment, thanks to COVID, is often not till around almost halfway through the pregnancy, which is, really quite disturbing from an antenatal health perspective. And I've had no shortage of conversations with women who are just like, is this normal? Should I not have seen somebody by now? I've only had a couple of conversations on the phone with a midwife, and I don't know if everything's okay. So yeah, women's choice.
This conversation we'd opened up, I think this is going to be a 6-hour podcast. I hope that's okay. I'm going to get my charger for my computer. Now I have a question, and I love that you've brought this up. Thanks for just being so open about this. For change to happen, is it top down or is it bottom up, in your opinion? For this,
well, that's a great question. I actually think I'm going to give you a third option. I think it's from the inside out.
Beautiful, love it. And
I think that for real change to happen, and we've seen historically when the most important and substantial changes and improvements to maternity care, they've not come from bureaucrats. They've not come from politicians. They've not come from hospital administrators or physicians. They've come from women and their partners. They've come from families who've said, this is not good enough. We demand better. We demand more, better care, etc. Be that partners being in the room with women during labour and birth. I mean, I'm at that cut-off generation. My dad wasn't allowed in the room with my mum when I was born. Changed very soon after, but so this is not ancient history when we've seen very big changes. I think, though, again, I think we're in danger of becoming a little bit complacent. I think that women feel, younger women, the millennials, if you like, I think for a lot of younger women, they feel, oh, well, our mums did all the hard work. We're there. We've achieved everything. It's all good now. And it's really not. If anything, I think there is quite a subtle kind of pulling of the rug from under people's feet, with it very quietly and very slowly, so you don't really notice the changes happening in real time. But I think this erosion of quite fundamental, really human rights, childbirth rights are human rights. And I don't think that, I think a message that I would like to really, make very clear to younger women is you need to hold on to those rights, because if you don't demand better, they'll be gone. So, I want women to be really proactive. I want them to be very powerful advocates themselves. I want their partners to be advocates as well, for the women they love and care for, and their future families. So I think that sort of revolution needs to, I think it's happening. I think there's definitely pockets all over. I mean, the work you guys are doing is a great example of bringing that power back to women. And I do see it, you see it with some incredible activists around the world who are just making, incredible changes and sort of disrupting, the narrative, so to speak. But it has a tendency to be a little bit preaching to the converted. So I think, one of the hardest things to overcome is, how do we reach the larger population? How do we reach that woman on the street who doesn't understand that she is having less and less control over her choices and options?
Wow. It's so amazing. And you think that obviously to look at other industries where there's been dramatic changes. So we look at the taxi industry, and we don't need to name the company, but
right.
That was the consumer. When we say the consumer, it was the people using the service that said, we want better. Whether it's right or wrong, whether people have those opinions about it, I totally agree with what you said.
Very true.
We need to empower the people.
Mm.
So when people typically, let's use Lamaze as an example, they typically search out Lamaze. What's drawing them to it? Like you said before, it might just be the woman on the street that doesn't know her rights. She obviously comes through and then realizes, holy shit, I've got a lot more than I realized.
Yeah.
Who typically and how typically do they find you?
Yeah.
What happens?
Look, I think one of the great things about, again, a younger generation of women is these are, digital natives, right? They've never known a time in their life where, the internet wasn't there and information was available at the literally touch of a button. So I think that one of the great advantages of, being a younger woman having a family now is that they're really smart, savvy consumers, right? And in all other areas of their life, be it professional, other consumer decisions, buyer decisions, etc., they're very, very particular about the choices they make, how they spend their money. They go with this company, not that company, and so forth. So that's one of the things I find interesting, is a little bit of an anomaly with pregnancy and birth, is how come women are so savvy with their choices in other areas of their life, but they're kind of prepared to just hand over control to complete strangers for something as profoundly transformational as pregnancy and birth, right? Having a baby is without doubt, if not the most, certainly one of the biggest life changes that we will ever go through. And so I think, women, when they do come across Lamaze education, I think what they recognize is that it's something that is not Lamaze. I mean, we sort of say Lamaze is for everyone, and it sounds quite generic, but it's a very true statement, in the sense that Lamaze is not a method or a technique, or something you have to learn specifically to kind of master a skill at. The essence of Lamaze is evidence-based information. It's about, again, putting that power back in the hands of the consumer. Here is the evidence. Here's what the research is. here are the skills, and this is what educators will do in classes, here are the skills that you need to make informed decisions for yourself, so that you feel that, you know, you have the confidence to go through that journey, making decisions that are right for you. So as educators, we don't say you should do this, you shouldn't do that, or in our opinion, this is the right way, that's the wrong way. It's about just presenting the facts, and helping women to navigate a pretty complex and confusing system. And obviously Lamaze educators, you know, we work all over the world, so we adapt our education to meet the needs of the communities that we're working with. So, you know, it isn't a one size fits all. It's not a, here's the curriculum and it's a cookie cutter class. You could go like McDonald's, right? You have a Big Mac in Beijing, you have a Big Mac in New York, it's the same Big Mac, right? Lamaze classes are different wherever you are. Each educator, you know, puts their spin on things and has their own way of communicating the information, but the fundamentals are the same. The foundation of Lamaze education is what's something called the 6 healthy birth practices. Really, that's what forms our classes, and they're all evidence-based. They're all adapted from World Health Organization recommendations. So I think the thing that women and their partners feel when they've done a Lamaze course is, number one, relief. That's like, whew, okay, I feel like I understand what's happening to me, to my body, what to expect. But again, very importantly, that they've got these tools and skills, not just to cope with labor, which is a very big part of it. Obviously, the physical managing of labor from a comfort point of view and pain management point of view. But even more importantly is the how do you navigate that system? How do you assert yourself? How do you feel that you can communicate really effectively with your midwife, with your doctor? How do you get heard and listened to? And how do you receive respectful care? So those are the things that I think are, you know, that balance really help people to feel prepared for this big event, this big life event.
Yeah, that's awesome. And so typically, actually, maybe even you can give me an example. You know, we don't need the name, so to speak, but
yeah,
maybe as there was someone that you can share that, you know, they come along and they learnt this and went, holy crap, I didn't realize that this is what I have to do, or that, you know, that they get that empowered knowledge on the other side.
Yeah. Oh gosh, I mean, over the years, I mean, I probably had almost 500 couples come through just my classes, and so over these many examples. But I often think of situations where people have come to a class and it's almost like you literally can see the light bulb go off in their head. It's like this moment of sudden clarity and realization that they've kind of, the thing is it's not necessarily that what I'm saying to them or what any Lamaze educator is saying is rocket science, but it's what I think it often does is spark in somebody who already has a little, you know, kind of rumbling or and something in really deep instinctive thoughts and feelings that something is not quite right. And then that comes together in a class with information they know is reliable and, as I said, evidence-based. And that's when they have that aha moment. It's the marrying of what their gut's telling them together with good information, which is almost giving them permission to go, I knew I was right. And they act on that. And that's one of the most gratifying things I feel as an educator, that, people can leave knowing that they're going to make really good choices for themselves. I also teach a Vbac class, so vaginal birth after cesarean, as a sort of an add-on. You know, it's a separate class, obviously, to just my standard Lamaze class, which is mostly aimed at first-time parents-to-be. In Australia, we have a 34% C-section rate. So there's a lot of people who need, education around Vbac. And I remember not too long ago, I had a woman in the class when we could do face-to-face classes, who she had gone back to the same obstetrician she'd had with her first baby, which obviously resulted in a cesarean section. And, I don't even remember specifically what it was I had said in the class, but she just kind of literally shouted out loud. Like, I don't think she realized that she was actually vocalizing what she was thinking internally. And she just went, excuse my French, holy shit. And she says, you're right. She goes, I can't have my baby with this doctor. I've got to change my care provider. And she was already about 30 weeks. But it was like she understood that she was literally being set up for a repeat cesarean. And he was just kind of like very gently just nudging her way along, you know, that repeat surgery. And she's like, no. So, you know, and she stayed in touch with me. She found she moved actually to a public hospital, managed to get onto an MGP, or midwifery group practice program, you know, and had an amazing Vbac, you know, and so there's so much power in good education, you know, it really has, you know, the potential to make just enormous fundamental changes in people's lives, you know, and, you know, the birth of your kids, again, it's not just, you know, a day you will never forget, but it I think fundamentally changes who you are as a person. You know, it changes the way you think, it changes the decisions you make forevermore about how you live your life. So, you know, how we birth really reflects how we will go on to live. So we have to get that right, you know, and when we don't get it right, the implications are really serious, you know, for people going forward. So
it's amazing. And thank you for sharing that story. They're the stories that need to get out, right? And I hear them time and time again. The problem is you have to go looking for them, right?
Right.
But you know, I just think in that moment for that woman, just the power in saying, I'm changing doctor. This is a big decision at 30 weeks, right?
Oh, yeah, right.
That's not an easy thing to do.
No.
Like what that would do for her as a woman is amazing.
Yeah, absolutely. Wow. I mean, even the financial implications there. She wasn't getting a refund. You know, she paid her, you know, probably best part of $8,000 out of pocket fees for a top private obstetrician. And I'm not denigrating the obstetrician. I mean, you know, we've got to remember that, you know, they're highly skilled and trained, you know, medical professionals, and they do amazing work, you know, but at the end of the day, you know, we've got to remember that midwives and doctors have very different philosophies. They may have the same end goal, right, which is to have really, you know, healthy women and healthy babies, but how you get there, they have very different pathways, and they make different decisions in their assessment and their clinical care of women. So
beautiful. One's a gravel road or a private jet. You're gonna come
pretty much.
You'll get there.
One way or another, you'll get there. Absolutely.
So this has been absolutely wonderful, Tanya. I have 2 questions, and I'd love to direct them separately. You can answer them in whichever way you choose. And that is, if you've got a message for birth professionals out there, knowing your mission, your purpose, and desires for women, you've got a message for birth professionals and caregivers, and you've got a message for mothers to be that first time, or be that, you know, Vbac mothers, whoever that is. What's your message for both of those groups?
Oh, it's a great question. So to birth professionals, so you're talking specifically about sort of clinical care providers like midwives and doctors, or everybody, educators?
I put everyone. I put doulas and chiros and childbirth educators. I put everyone. Yep. To me, they're all the birth professionals that make this magic happen.
I think the main message I would have is that we need to always remember who is the center of what we do, of everything we do, is the woman. And I think most of us do that, and do that really, really well. But I think sometimes, particularly health professionals who are working within systems and working within institutions, often find it very challenging to keep doing that and to keep that center of mind. I mean, you know, I'm an independent birth educator. I'm a private doula, so I don't have to walk around with the hat of an institution. I'm not bound by rules, regulations, policy, guidelines, etc. I mean, I'm ruled by a code of ethics and a scope of practice, which keeps me working within very strict parameters, obviously. But, you know, I have that freedom to express myself. I have the opportunity to provide clients with, really good information that is unbiased, that is evidence-based, etc. So I think my message would be, particularly to those birth professionals who are working in, and they know it themselves. I have lots of midwives who do my Lamaze training, who express their frustration with the system, it's not women who are broken or women's bodies that are broken. The system is broken, except it's the women who beat themselves up about, the fact that they somehow failed themselves or failed, their bodies failed them. So I think, I just want us to get to a much more simple point where the starting point of everything we do, every communication we have, every conversation we have, every decision we make, we go do an internal check and go, am I putting the woman first? Is she the center of my care and the decision making? Has she got autonomy in her decision making? Am I coercing her in some way? Even subconsciously, am I trying to drive her to make a decision that I want her to do or to make? Or am I saying, here are truly your options. I'm going to put everything out on the table. You decide what's best for you. That would be a fundamental shift in the way we deliver maternity care. If we truly put the power in the hands of women and trust that they will make the best decision for themselves, so that's something I would love to see. And I think my message for mothers to be would be, trust yourself, trust your instincts, trust your body, trust that you know what's best for you. You mentioned earlier about how you have to almost search in a sea of, really negative, fear-mongering stories to come across the little positive, gems and the positive birth stories out there. I think, you would see them and Ginny would see them in her work all the time, are women who are just experiencing such crazy levels of anxiety and self-doubt, because that's the narrative that we're fed. And we're fed it years before we think about having babies. Let me tell you, I have a 10-year-old daughter who, despite the fact she's growing up with a crazy birth mother, is still not immune to these very disturbing messages that creep in through social media. They creep in through mass media and TV and and TikTok now, everything else that she, is in her world. Being proud of who she is, of having, pride in herself, pride in her body. And I think when, if we can sort of raise a younger generation to feel that they're powerful, that they have, again, that bodily autonomy, and the right to make their own decisions. I think we've got to put that power back with women in the birth space. So, I'd say to women, go out there, find the positive stories, find your tribe, and when you are ready to have a baby, and I say this, unfortunately, it's too late in childbirth classes because I'm meeting them usually in the 3rd trimester. But I say it till I'm blue in the face. The 2 most important decisions you need to make when you're pregnant is, where are you having your baby and who are you having your baby with? Don't just go with what your GP told you or what your best friend told you or what the book said. You have to research your options. You think about people when they buy a house or buy a car, how much crazy research they do, right? For months on end usually. And yet we just go, okay, I'll go with Dr. So-and-so because my best mate did, or because the doctor said. So really do that early research when you have the ability to make really good choices about, who you want to have your baby with.
Oh, it's amazing advice. And you just brought up a question before I got asked this. What should mothers be telling their daughters? I don't say fathers at the moment. I'm directing mothers, because I know
what should women tell their daughters? That they're powerful and strong and that, you know, they're in charge. It's their body, and that they're the decision maker. I mean, we do it in consultation. We do it in collaboration with our care providers. There's a lot that they bring to the table. They bring knowledge, they bring expertise, you know, that we can't discount at all, but not to the exclusion of a woman's own understanding of her body. And again, that powerful gut instinct, which I think in pregnancy is kind of like, you know, on high alert. You know, we're highly sensitized in pregnancy. And so, you know, rather than go, oh, that's not very scientific, you know, I'd rather listen to what the doctor says. You know, listen to the doctor, listen to your midwife, absolutely listen to them, take on board what they have to say, but not at the expense of going and shutting down what your own gut's telling you as well.
Amazing. Tanya, this has been absolutely incredible. Now, for people listening in, how will they find you? I mean, I'm going to have some information under this.
Yep.
Fine, but maybe you can share. I saw your amazing new website. Is that launched?
Yeah, it has launched. We're so excited about it. So it's super easy. It's lamazeaustralia.com.au. We have all our certified educators on the website. So if you're anywhere in Australia, you can find an educator that's, you know, in your area. They're all amazing. They're all fully qualified, certified by Lamaze International. So that's probably the easiest. We're on Facebook, we're on Instagram, but you know, you can post those links to people. That would be great. So that's where you'll find me and others like me.
Wonderful. I've got one last question, Tanya. What's your favorite quote? Your birthing world.
Oh, okay. Oh, my favorite birthing quote is "Peace on earth begins with birth."
Right.
Which I think is...
Thank you so much for your time. Absolutely wonderful. Look forward
Pleasure.
to you being released from lockdown whenever that happens.
Oh, yes.
And enjoy that amazing Melbourne coffee that you can get in takeaway at the moment, I'm sure.
Yep, absolutely. Thank you, Andrew.
Thank you so much. And thank you everyone for listening. As I said, just have a look underneath this. You can see how you can get in touch with Tanya. Really sincerely hoping that there's birth professionals listening into this that really resonate with, and mothers to be that listen in and go, hang on a minute, I might be being led down a path that maybe is not the be all and end all of my choice and the power that I have. So Tanya, I think you really brought that to light today. Thank you so much.
All right. Have a great day. Bye.
Thanks for listening. If you have the voice to empower the birthing world, speak up and reach out to us. We would love to hear from you. Until next time.